Hi, everyone, and welcome to the lesson on health and society. First, let's look at the idea of the medical model. The medical model is used mostly by medical professionals such as nurses, EMTs, and doctors. The health staff and hospital staff will often implement a medical model when understanding the body. It's the predominant way of thinking about health and illness. So, what it focuses on is researching, diagnosing, and treating diseases and illnesses that occur within the body. The focus is so much on the internal components of disease, understanding the different parts of the body and how it can be affected by various illnesses and ailments, what can be done to treat them, and what the experiences of these folks are like, that we forget about a person's social location. We forget about the broader context that perhaps brought the body into a crisis in the first place. So the medical model is important when faced with a health bodily crisis, or for trying to understand how a body can be kept healthy. But for understanding the root cause as to why certain populations have more health issues than others, we need a different model. We need the social determinants of health model. This is a model that focuses on how our social environment, our social location, our place in society in terms of race, gender, and social class, among other social factors, also influences our health and our potential for living a healthy and prosperous life. Poverty and being low income are highly associated with higher risks of health problems and also mental problems as well. Poverty and low income is associated with lower life expectancy and less less of a lower quality of life. So the research is almost unanimous in suggesting that social inequality is equitable or very much correlated with health inequality as well. Let's examine our approaches to medicine in the United States, our hospitals. The way that doctors and other medical professionals are trained is to deal with crises, to deal with moments when the body is not in a normal state of mind. These types of situations are known as acute illnesses. Someone gets appendicitis and they need to have surgery. Someone has the flu and they need medicine to at least make the symptoms go away while their body fights the flu. Someone has a heart attack and needs to be treated. Acute illnesses are fixed through hands-on surgical or medical applications, such as medicines, vaccines, or surgical procedures. Chronic illness, on the other hand, are things like diabetes, heart disease, cancer, and mental health issues that are becoming now more and more common than ever before. Chronic illnesses are not fixable in any sense of the word. They can only be treated. The symptoms can be addressed. The different aspects of the illness can be monitored to make sure that the person isn't going into any sort of dangerous physical condition. About 40% of the population, almost half of us in the United States as a population, especially the older we get, suffer from some sort of chronic condition that has no cure or end in sight, but has to be treated through a number of different processes. So our hospitals are best suited, and our doctors and professionals are best suited for acute illness. However, chronic illness is the new way of the world. So there needs to be some kind of approach where doctors can begin to be used less because we are in need of a different type of approach than the heroic medicine approach. The heroic medicine approach is technology-driven, hospital-based. You need specially skilled people to perform this type of approach, and it's used when the body is in crisis. So it comes in handy when a patient is already in crisis. They've overdosed, or they are having a heart attack, or they're having a stroke, or they are going into some sort of seizure. The body has ceased to operate as normal, and heroic medicine is needed. We need the technology and the special skills and training that are associated with heroic medicine. Preventative medicine, on the other hand, seeks to treat the population, not the patient. So we're talking about neighborhoods with low income, with a large number of low income members that need access to healthy foods, to places to exercise, to education, to better job opportunities, economic opportunities. And so, with preventative medicine, we're trying to mobilize to prevent social inequities that lead to health inequities. It's largely about education, but also about changing government and policy to provide economic opportunities to folks that need it in order to improve their health and their well being. By the time that we need heroic medicine, it's kind of too late. We could have been treating society through preventative medicine and reduce the need for expensive surgeries. So, when it comes to healthcare in the US is the only industrialized democracy that does not provide some sort of universal healthcare to all of its citizens. This often leaves millions and millions of citizens uninsured and unable to access healthcare. On top of this, even those who have health care still pay a large sum in out of pocket costs. Out of pocket costs refer to the amount someone spends on health care. So, this is on top of what the insurance pays. You're still expected to pay a certain amount depending on the agreement. The U.S. pays much more out of pocket costs compared to anybody else in the world, especially in comparison to other industrialized nations. Although we spend a lot more on healthcare, it doesn't mean that we're healthier for it. We actually don't have an upper hand in the health qualities of our citizens. We have some of the most unhealthy citizens in the world. Here's a graph that kind of demonstrates how much is spent out of pocket for your typical baby delivery. It is split into cesarean deliveries and normal deliveries. You can see that the U.S. pays the average U.S. person is going to pay thousands and thousands more than your Swiss counterpart, Australian counterpart, Dutch counterpart, Argentinian, and Spanish counterpart.